Tell me about your background in physical therapy and how you decided to make Pilates such an important part of that.
Chronic pain can be a bit complex. Pain is not always this indicator that ding, 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 we've damaged something.
People avoid doctors at all costs.
There's just not one size fits all. You need to train to allow yourself to do your sport. The sport isn't the training.
I tell patients all the time, like, this is not going to work. Whatever we do, an injection, surgery, without physical therapy.
Movement is healthy. Movement is safe.
You could have the worst x-ray in the world, but you don't need surgery anymore.
This is really a long-term commitment. It doesn't just stop with 12 PT visits.
Today on The Resilience Factor, I'm joined by Ariel, founder and owner of Pilates Sante, and a physical therapist who helps people build strength, improve movement, quality, and restore function over the long term. In a world that often rewards pushing harder, Ariel's approach focuses on something different, improving movement patterns, correcting imbalances, and building strength that supports the body over time. Her work sits at the intersection of rehabilitation, mobility, and performance, helping people move better and stay active with more confidence. We'll be diving into why most injuries start long before you feel the pain, how Pilates fits into a modern approach to performance and health, and what it really takes to build a body that stays strong and resilient over time. Welcome to the podcast, Ariel. So Ariel and I are colleagues in Los Gatos. I do a lot of referring to you, not just because you're a Pilates instructor and own a Pilates studio, but because of your background in physical therapy. So I would love to start there. Tell me about your background in physical therapy and how you decided to make Pilates such an important part of that.
Yeah, I started in Pilates, like actually physically on a reformer when I was at the age of 12. I was a pretty serious ballet dancer and I had an injury and I was introduced to it in a traditional outpatient physical therapy clinic and I fell madly in love because at that time I couldn't dance and I was feeling really like I needed to move and train. And I was able to do that safely with the Pilates. And so from that point on, it became actually a part of my lifestyle. And then years down the road, when ballet didn't become like the profession that I thought it was going to be, I went to physical therapy school and I knew that I wanted to incorporate it into my practice when I graduated. And so I did traditional outpatient orthopedic therapy for about 7 or 8 years. And then I opened Pilates Sante in 2008.
That's amazing. So tell me, let's go back to your ballet career.
Yeah.
When did you start dancing?
Pretty much when I could walk. Yeah, ballet was everything. So, and Pilates was a way that I could continue to dance with less injury. I really did it to train in a safe way and be able to keep me monitor the injuries, which I had kind of chronic injuries as a ballet dancer. Yeah.
Ballet is so demanding on the body. At what age or what stage in the career did you realize, okay, I'm going to have to cross-train or do something to help with the injuries, as you were saying?
Yeah, I think it happened at that very early age with my first a tendonitis or a tendinopathy of some kind that I had. And then I started to be able to train my core and my hips and continue to move without the stress and the repetitive use of my foot and ankle. And then from that point on, I used it. I mean, I had stress fractures in my late teens. So there was a lot I was training through, but I could do that pain-free using the Pilates equipment and the mat work. So all of it.
Okay, and so tell me about your certifications within Pilates, because you obviously went to physical therapy school, which is 3 years.
Mm-hmm.
And then when did the Pilates certification happen?
Soon after, I think around 2004, you can go through. I mean, the programs have become a lot more thorough and extensive now, but it's usually somewhere between a 10 and 12-month program, where you're meeting at least once a weekend and you're learning about all of the movement and apparatus. But with that, I think there's still kind of a gap in terms of learning about injuries in special populations like osteoporotic clients or scoliotic clients. And so that's where I'm now really passionate, like we've talked about educating Pilates teachers about how do we use Pilates to work with clients that aren't just for fitness, that have pain and injury and other conditions that are more complex.
So when you have a client or a patient come in,
Yeah.
what is your algorithm in trying to build out a plan for them? And you were mentioning earlier that, sometimes people are now coming and they have an injury in their neck and their knee and their foot. And sometimes they know exactly what's going on and sometimes they have only just a little inkling of an idea. So how do you mesh your physical therapy knowledge with your Pilates knowledge and make a plan for them?
Yeah. So at Pilates Sante, we have 3 physical therapists, including myself, and then we have about 10 Pilates instructors. Typically, most clients that come in work with a physical therapy therapist for the initial evaluation. So we do a pretty traditional PT evaluation, and then we kind of triage where does this client fit best? Do they need to work with a physical therapist? Like, are their symptoms fairly acute, or is this more of a chronic issue and they're moving really well, but they need some guidance? That would be more of a Pilates instructor. And sometimes it's a little bit of a combination where the PT will see the client once a week and the Pilates teacher will see the client once a week. And we're really working as like a team.
I love that because I think physical therapy is such a important part of my practice. I tell patients all the time, like this is not going to work. Whatever we do, an injection, surgery, without physical therapy. But then recently, probably in the last year and a half, I've really focused on you either need a good personal trainer or you need a good Pilates program. It's not just about going out and getting your 10,000 steps in anymore. It really is about building that strength. So how do you talk to patients who come to see you and have all these pains and they say, but I walk everywhere?
Right, right.
How does that conversation look?
Yeah, I mean, essentially, I'm probably pretty direct in a kind way where it's not enough, especially with the women. We see a ton of perimenopausal and postmenopausal women. It's like, no, we need to do more, and we need to use resistance, and that could look like spring tension on the reformer, but we might need to add some weights and some bands and things of that nature. So, and that this is really a long-term commitment. Like, it doesn't just stop with 12 PT visits. We need something that goes on for good, that you like, that you'll be consistent with, that you'll make a commitment to.
Yeah,
Yeah.
no, I think that telling patients that this is not just an 8 to 10 to 12-week thing, because I get that all the time too. Well, how long do I need to go to physical therapy?
Yeah.
And oftentimes my answer is, well, you're going to go for this long, but you're going to be doing those exercises probably for a lifetime if you
Right.
have a weak part of your body. So tell us the differences between mat Pilates and reformer Pilates, because that's probably something a lot of people ask about. And the reformer looks like a lot more fun. So I'm sure people are gravitate towards that. But what are the differences and how do you utilize both practices?
Yeah, so at Pilates Sante, our Pilates may look a little bit more modified. I mean, a lot of people have an image in their mind of what Pilates is, especially on mat, like somebody doing some sort of an abdominal curl or things, but it's really much more extensive than that. Like, we're really teaching people how to move in their bodies, be present and see the imbalances and work on those imbalances. On the mat, typically we do use some props like bands and circles and blocks and balls, but typically you're using your own body weight. Whereas on the equipment, we're using spring tension and resistance. So we try to do a combination of both at Pilates Sante. It depends on the client. I mean, some people have a load sensitive condition, and there might be a period of time where we need to unload them a little bit,
Sure.
especially in the spine. We do a lot of that. And then other times we're trying to build bone density or build resistance to build muscle and strength. So it just really depends on the person that's in front of us. Some people need a lot more mobility. Some people are working on alignment and control, like our scoliosis patients. So we try to really be intentional with how we're using the exercise method. And that's what I think is so cool about it and why I'm so passionate about it. I mean, I feel like he was just brilliant when he developed this method in the 1920s that's now really, broadened. But like, you can use the approach. If you have those tools, you can just change which tools you're using based off of the person that's in front of you. And that's just what I think is so neat about it. It really addresses the whole body. I mean, I loved working in outpatient physical therapy. I loved it. But sometimes I felt limited to 8 to 10 sessions into a single body part. And what's so
Yes.
cool about this is it's like, hey, we're going to train all of this while you're recovering from your knee surgery. And they love it because they feel a lot of times out of shape, like they've been limited. Like, yes, let me get my upper extremities working. Let me get my core working. And all of that is going to help long term their knee rehab as well.
Okay, I would love to hear from you how you would describe the core, because that is probably one of the biggest issues I have, or educational pieces that I think is lacking for a lot of patients. Is we all think the core is our belly and our abs, and so we do a plank and we've worked out our core,
Right.
and that is just not true. And I think a lot of times the low back pain that patients feel is coming from so many other body parts. So Tell me what the core is in your words.
I mean, even in the PT world, I feel like for so many years, we were so biased to just train the front body. And now what I explain to clients is like, okay, yes, because they come in wanting the core. And I say, hey, we're dealing with a whole cylinder here. Like you need to train your back muscles just as much as your abdominal muscles, just as much as your gluteal and lateral hip stabilizers. So, the word sometimes we'll use is lumbo-pelvic stability, but let's learn how to engage our lats and our glutes. Like this is all a piece of it. Our scapular retractors, our upper core muscles, like it's really not just that lower abdominal area, right? So I feel like what we do is to not isolate, but actually integrate. And we try to give exercises where they're needing to use oblique slings. They're needing to use lateral hip abductors and they're doing it simultaneously. And that's what I think of as like core connection. And then on top of that, we add breath. And that's a big part of Pilates too, right? And using our breath to help encourage not just nervous system downregulation, but also like efficient engagement of our deep core system. So the principles of Pilates just help that naturally occur. But it is true that many people come in with that picture of I'm going to do a plank or a sit up and then I've done my core work. But really what we're looking at is what is the position of your spine and pelvis as you do this exercise? And is your spine protected, and are you getting appropriate training from this exercise?
And do you do that core work? Well, a lot of Pilates is core work,
Yeah.
but in your workout or your the what you've prescribed for a patient, are you doing that core work at the beginning, at the end? I remember back when I was in high school, when you take like an aerobics class, the core was always at the end,
Right.
which now doesn't make any sense at all. We want to warm up that core before we're going to lift weights. So where do you incorporate it in your
I would say it's
plan?
kind of pieced throughout the entire session. So it doesn't look like we're doing an isolated abdominal exercise. That's what's so cool about this work is that we can have them using these muscles when they're working just with an arm movement. So it's really less direct, I guess, but really intentional still at the same time. They're using it throughout all of their movement, whether they're starting a warm up exercise like a bridge or something on hands and knees. We're still encouraging the core to work and we're encouraging and cueing the breath, based off of the movement pattern of the person in front of us. But it's essentially a part of the entire session. There's never a time where we're not really having them focus on what's happening in their center.
That's great. You've weaved it into the whole workout program. And then tell me more about breath work. I have interviewed a couple physical therapists, and I actually was quite surprised at how much focus has been put on the breath. I also had someone here and we did meditation, which is impossible for me to do, as for a lot of people.
Yeah.
But I really did like how she spoke about grounding yourself into one thing, like whether it's your feet or the breath or a particular pose. What does breath work mean to you, and how do you get your patients to do that?
Right. Yeah. So, I mean, there's so many different types of breath exercises nowadays, which is very cool. But in Pilates, how it is a little bit different, say, than in like yoga, is we used a forced exhalation either through the mouth or the nose to actually engage the system to kind of prepare it to move. Versus in yoga, you might exhale, mouth or nose, and it's to relax and release. But the cool part is we're just still encouraging breath and we're still getting this nervous system change. And I think especially in this area, we have so many clients coming in with just like upregulated nervous systems, high cortisol levels, which is contributing to chronic inflammation and pain. And so no matter what type of breath pattern they do when they lie down on the mat, as long as they're breathing, I'm seeing their nervous system shift. They'll come out of the session and go, oh my gosh, my back pain's better. And we haven't even done that much except calm them
Wow.
down. So I think it's so powerful. And I think I think it should be taught in schools. In fact, I went to my daughter's school last year. They had a life skills class and I taught seventh and eighth grade boys and girls breath work because it's like we need tools to manage the anxiety and the stimulation and all that's kind of happening
No,
nowadays.
absolutely. We have to be able to self-regulate, and the only way we can do that is if we have the tools to do those things. I want to switch gears a little bit. A lot of people now are taking GLP-1s. And some of it is for management of diabetes. And we know they have great benefits to the cardiovascular system and inflammation and obviously some weight loss. But what we're seeing now, too, is a loss of muscle.
Mhm.
So tell me what you're seeing in in your studio and with patients and how you're educating them around that.
Yeah. So, yes, we definitely have clients on GLPs losing. What's tricky is that I would say I probably haven't worked with enough clients on GLPs to see dramatic muscle loss, but what I encourage them when they start is to continue the resistance training. They have to continue the resistance training so that they can kind of counteract the effects of it. And then, of course, dose it appropriately because it seems like the ones that lose weight quicker seem to have that sort of like abrupt loss. Yeah. And the skin integrity changes and all of that. So, I'm definitely an advocate of like, you're going to work here, but you're also going to need to resistance train outside of these 2 to 3 times a week sessions. So, yeah.
I think that's really important
Mhm.
because I have noticed that I'm just going to say women for instance, I feel like when they keep going with their resistance training and their strength training, they are less likely to lose as much muscle or at least try to retain it and build it as they're losing that fat. So I do think that's very important. What are you seeing with patients with low back pain? What are you doing for them outside of just working on the back?
Yeah. So we see a lot of chronic low back pain, and it can be really complex. I mean, I find that retraining poor movement patterns is really the key. So some of them just have habits, we all do, of how we move, and some of it's not serving kind of the healing process of their back. We also work with a lot of people that have fear, they've had bad experiences with previous practitioners. So there's kind of this slow gain of trust sometimes of like movement is healthy, movement is safe. These sessions are good for you. Like pain is not always this indicator that ding, 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 we've damaged something. Because I think a lot of times they're in so much pain and they're upregulated. And so it's like anything can trigger it, right? It's like the nervous
Yes.
system isn't reacting accordingly. So just teaching them that they're in a safe space and continuing to build the trust. And then, of course, address all of the imbalances. Some people come in and they have tight hips, other people come in, they're completely hypermobile and unstable. So there's just not one size fits all. I think it's really important that we can't treat all low back pain the same. That's,
Absolutely.
yeah, yeah.
I think it's again, maybe it's just misinformation from people seeing it on the internet, but I have so many patients that come to me and say, "Oh, I have sciatica." Like that's the catch-all word
Right,
for some kind of pain that's going down your leg.
right,
And I say, "Well, I don't know that that's exactly what's going on here right now, but let's
right.
evaluate and figure it out." But the programs are going to be different if you're dealing with neck pain versus low back pain versus as a radiculopathy where the pain is shooting down a leg. I would assume that's true and where you are at as well with your patients.
100%. And that's why I mentioned, like, prior to us starting, is Clinical Instructor Academy is this new business that I formed that I'm so passionate about educating Pilates instructors about these different types of conditions, not so that they're going to treat patients, but so that they're aware when these clients come to them that, okay, this condition is not X, this is Y, and I have to address this differently. Because right now, the profession is in this process of kind of up leveling where they might be told things not to do with someone that has low back pain, but it's not specific enough. It's not specific enough for them to be able to really help somebody that comes with a condition. They're not educated to that level. And so I'm really trying hard to fill that gap of like, let's educate you about these injuries because you're seeing these clients.
Yes.
You're seeing them after physical therapy or sometimes instead of physical therapy. And so they need to be more prepared to be able to use the tools they have to work with clients that have more complex issues.
And oftentimes you're the first line of defense. I mean, they look you up, they come to you. People avoid doctors at all costs. So they sometimes are going to a personal trainer or a physical therapist or a Pilates studio because they know something's wrong.
Yeah.
They're not exactly sure what's wrong
Yeah.
though. So I think that education piece for your instructors is super important. Let's talk about nutrition. Are you doing any nutrition education for your patients?
I tend to refer to nutritionists that I trust and like, but I'm all about creating teams for my patients. Like, I am like, this isn't my wheelhouse, but I think this person you should speak to. Some of the conversation we will have is that I think that some of their habits might be contributing to chronic inflammation, and then I'll refer them if they're open to it to getting assistance. There are a few supplements that I do carry in my studio just because some people like to have access to it right away.
Sure.
Inflammatome from Designs for Health is one of them, but there's a few different products, some CBD products of people that are just desperate that, don't want to be on meds at this time or go on meds again, and they're open to it. They're really open to it. But I do explain that like what they ingest and like their food intake is just as important, if not more. So
It's honestly 80% of it sometimes,
Mm.
and, I love that you mentioned the supplements because I do think, um, a holistic approach is becoming more and more important. Are you sending them off to acupuncture or chiropractic? What other tools in your
Yes.
toolkit do you have for your patients?
Literally, that's my circle. So it's acupuncture, chiropractic work, massage, sometimes cranial sacral, the nutritionists. Um, I've done life coaches and yoga teachers, if people are really upregulated and wanted to learn meditative or breath techniques. So just all about approaching it with a group of good professionals because chronic pain can be a bit complex and sometimes just movement alone might not be the only answer.
It's so mentally
Yeah.
depressing too, and which affects the whole body at that point. Okay, what about moms? Pregnant people and also moms, new moms.
Yeah.
How are you building out programs for them? Would you suggest that someone who's pregnant comes to you early on? Wait till, 3rd trimester when they are, their ligaments are lax and they're having a few more issues, or wait till that baby's born? Tell me where you
Oh my
where you
gosh.
fit in there.
I love Pilates for pregnancy. I would love to have a ton more Pilates patients. I did it literally until the day before I gave birth, and I had such a good birthing experience. So I feel like it definitely prepared the body. So yes, in terms of organization and control and continuing to maintain mobility and stability, all of the things pre-baby is amazing. And then postnatal too. I mean, actually, I just evaluated someone today who's got some different kinds of pelvic floor issues after having her baby, and like Pilates, she was referred to Pilates, and it's like, yeah, let's get working. She's about 5 months postpartum, so um, I think she's gonna do great with lumbo-pelvic stabilization and breath work and retraining again, like she has a new body now.
Yeah,
Yeah.
absolutely. And then for the aging population, not quite there yet, but I will say my mobility has gone down quite a bit. What are you doing for mobility, and how are you teaching your clients to incorporate that into their routine?
Yeah, so we have clients. I think our oldest client is 87 right now.
Wow, that's awesome.
Yeah, I just love her. And so I love working with them with Pilates. So we do a ton of functional mobility that doesn't look like traditional Pilates. Um,
Tell us an example.
I mean, just like before they get on the reformer, I might have the client do sit to stand off the reformer like 8 to 10 times, like
Yeah.
basic things. Sometimes I'll even incorporate with her, like we'll go out to the stairwell, we'll work some stairs, and then we'll come on in and we'll do some stretching. So we're trying to, because Pilates has been, there is a thought, is it functional? It's like, okay, well, let's make it functional. We can incorporate these things into it. We do a lot of balance work in fall prevention. In fact, we hold workshops on that because we've definitely had clients fall and have, repercussions because of it. So, and then we do a lot of work to build strength and bone integrity through the back muscles. That could be like in sitting or prone, standing, all of it. Resisted work, even to work on their grip strengths. Yep. And then, of course, like you said, mobility of the hips, the knees, the ankle, and foot.
Yes.
So sometimes it'll look like practicing getting on and off the ground. Like one of my patients, she's a fairly recent, she lost her husband.
Widow.
Widow. Thank you. I'm sorry. I just
It's
had a
okay.
moment.
Yeah, I have
And
those all the time.
yeah, so she's having fear of falling in her house and she's living by herself for the first time ever. And so we just practice as a part of her session. She's got arthritic knees, and we're like, okay, so this is real. Let's figure out how we're going to get on and off the ground if this were to happen.
That brings up a really good point. So her life has changed,
Yep.
and so now she's trying to sort of figure out how she's going to thrive in this new situation. I'm often telling patients in my office, you have, bone-on-bone arthritis in their knees. Let's say that as an example. And there's really not much we're going to be able to do in terms of injections anymore. So the next step probably is a knee replacement. But I do think physical therapy and or Pilates could be really helpful to you. How are you managing the mental aspect of that with a patient who comes in and feels like, gosh, I'm going to end up in surgery anyway? So why am I doing all this? And what can what am I going to get out of this?
Mm-hmm.
Because you and I know a lot can be
Yes.
done with weight loss, strength training, Pilates, PT that could make it that you could have the worst X-ray in the world, but you don't need surgery anymore.
Yeah, that's so interesting. This is just the conversation I had with this same client a day or two ago. And the whole concept was that she had one total knee. She's already had, and it's done so well, but now the other one. And she's like, I don't want to do that right now. So I'm like, okay, can we commit that you're going to 5 days a week do something to train this leg? I'll give you 3 exercises to do at home. It's like we made a solid handshake on this. She's like, can I just come here 3 days a week instead? I'm like, you can do that, but I would love for you to commit to doing stuff outside on your own to train this whole lower chain and see if we can offload the knee a bit and calm it down a little bit, get you moving more. So, I think that for the most part, I'm very fortunate to work with pretty driven patients in our
Yes.
area. Yeah, I know that's not the case for all PTs around the nation, but like here, we work with people that really want to get better, and they'll work with multiple practitioners and they'll do their home
Yeah.
exercises.
Well, I will say in this age of wellness and preservation, I feel that there's more motivation to not have the knee replacement, not have the surgery and try and optimize the body the best that can be. And I do feel very strongly that with the right program, you will be able to decrease the likelihood of some of these surgeries if you can take the weight off the joints and if you can strengthen some of the muscles around it.
Yeah.
We can absolutely achieve that.
I love that you think that way as an
I do.
orthopedist.
I definitely
Yeah.
think cutting is something that's,
Mhm.
I'm skilled at, can do,
Yeah.
but it's not always the right answer because we really have to look at the whole, the holistic part of what the patient is going through. So, for instance, your client, she just suffered a loss. She doesn't have the probably mental or physical strength to recover from a total knee, which could take up to a year sometimes. And so she really does need another option, and I'm so happy that we have that for those patients.
Mhm.
Okay, let's switch gears. You started your studio 18 years ago.
Yeah.
What was the impetus for that?
I mean, I always knew I wanted to incorporate Pilates into my physical therapy practice. And then essentially I started doing it like I was working in outpatient ortho. I'd treat for 8 hours. And then I got a reformer in my little condo in Los Gatos. And I think I got my first referral. And I started working with her. And then it just continued to build. And I was like, am I going to leave traditional PT? Like that feels really scary to me. But I felt so passionate about the Pilates. So yeah, then I opened up a space and hired my first teacher, and it's become quite a journey because what I love is working with patients and teaching teachers, but managing a business and managing a staff of 15 has been a definite learning
Experience.
experience.
So we don't go to school for that. I'm sure you didn't learn about that in your physical therapy school.
People skills.
Yes,
Yeah.
absolutely. Okay, and to patients that come in and talk to you about resistance heavy lifting,
Yeah.
because that's very big on the internet, social media, Instagram right now
Yep.
is lift heavy, lift heavy, lift heavy. And I do believe lifting heavy is important
Mhm.
and for the body, but some people find that to be scary.
Mhm.
So how do you incorporate a program that has both of the things?
Yeah, I mean, we have that discussion with clients because sometimes there's just a pause where they might be able to not tolerate that load. And so we're like, okay, we're going to work with your body right now and get you more organized, more controlled, more inherent stability. And then let's try to start to manage more load. So that's kind of how I approach it. We do have weights at the studio, not super heavy weights, but we start to progress them to see. And then that's when I start to refer back to their trainer. And I say, okay, you guys are going to start to work with your trainer again, and you're going to gradually increase the load. And I have conversations with trainers. So I'm all about just like working with the condition that's in front of me.
That's great.
Yeah.
Do you have an ideal amount of time that you would recommend to a patient to do like heavy lifting and Pilates in a week? What do you do for
Oh,
yourself?
I know. Well, as I mentioned before, I'm not as balanced as I'd like to be. I lift at least 4 days a week and do Pilates 1 to 2 times a week. But that could look a lot of different ways. That's what feels good in my body. Some clients come to us 3 times a week and then lift twice a week, but I think the good part is that we're all starting to move to some agreement. It's not quite as separate, I mean, yogis are lifting weights now, Pilates instructors are lifting weights. So we see the benefit of all these different ways of training, complementing each other.
I think it's great because I love that you as a Pilates instructor lift heavy 4 days. That's great. That's a great modeling for your patients. Okay, let's talk about kids. I am seeing more sports injuries in my office,
Mhm.
especially as Little League season has taken off. And so I'm seeing injuries. So what I'm having conversations about is doing the rehab and the PT and working on with bands and other things.
Yeah.
What are you seeing on your end, and how early is too early to start Pilates for a kid?
Oh, I know. That would be, I mean, we have patients as young as I would say, well, I think on Saturday I have an 8 or a 9-year-old coming in for
Amazing.
evaluation. I know. But I think what's happening is so much repetitive overuse, like the intensity of like adolescent and childhood sports, right? Is it just escalated. And so the demand on the body is just so much higher. And so the conversation I have is you need to train to allow yourself to do your sport. The sport isn't the training. And so I know this stuff may not look fun and be as fun as like hitting a baseball, but we got to do it. And usually they're on board. Like they're like, if I'm going to be able to do this sport better and without my hip pain or my knee pain or my shoulder pain, they're on board. So I've worked with, yeah, I would say a lot of dancers, baseball, basketball, hockey, a few hockey players. Yeah.
Yeah.
So
Well, I'm noticing with my kids, like, why are you becoming more inflexible? What's happening here? You used to be able to touch your toes. Now you can barely touch them. And I'm seeing that as they're growing a little taller and they're getting kind of stuck in the one sport, some of that stuff is going away.
imbalances kind of.
Exactly.
Yeah. And I think the training, the athletic training and the coaching, it needs to be up leveled if the sport is going to be. And there's probably another gap there. I mean, my daughter, who's 12 years old, is in cheer, and it's like the physical demands that they have, and yet even just their warm up is just silly. Like
Yes.
it's hard to watch, and I'm like, ooh, is the body really prepared to do what you're about to do? Okay, good luck.
Got to get out there, mama, and teach them. No, I feel the same way. I was just telling my husband the other day, I'm like, there is definitely an uptick in
Mhm.
little leaguers' elbow and shoulder injuries too. And it's not just random. And I know they're all playing year round now, but I also think we're just not giving enough time and attention to the warm up and the cool down
Yeah.
and what's being done between
Cross
practices.
conditioning.
Yeah. And these
Yeah.
kids, probably your daughter, they're also doing stuff at school. These kids don't stop. So they're
Yeah.
throwing things and they're probably, doing their favorite tumbling pass at school. And so they're not really giving their bodies a break either.
Right.
Well, Ariel, I loved having you on today. Thank you so much
Thank
for
you
that.
so
And I
much.
would love for you to tell our listeners where they can find you.
Yeah, so pilatessante.com, and I'm on YouTube, Instagram, and Facebook, and Clinical Instructor Academy if you're a Pilates instructor interested in more education on injuries and complex conditions.
I love it. Thank you. Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.